The number of COVID-related deaths is rising drastically here in the U.S., even with the vaccine rollout. Since this time yesterday, we've added about 2,000 deaths to the total. And at this rate, we could reach 400,000 deaths by later on today. And while we watch those numbers, we're also learning that more children are being hospitalized because of COVID-19. So Dr. Dyan Hes is the founder of Gramercy Pediatrics, and she is here to break down some information that we're getting about a new study about kids and the coronavirus, doctor. The study is in the journal JAMA Pediatrics. It found that more than 5,300 children and teenagers in 22 states were hospitalized with COVID-19 between May and November. The average number of hospitalizations, though, went up as the study went on. So obviously the virus is spreading. There's more virus out there. So the expectation is more children will probably contract it, but more hospitalizations is sort of a whole other thing. So is this something we should be concerned about? What should parents be looking out for?
Well, I think that this study is a perfect example of why we need to wear masks, because the highest rates of hospitalization were in South Dakota and Arizona, where masks are recommended and they're not enforced. And I happen to know that in Arizona, there have been gigantic sports tournaments, people flying in, driving in from other states to have soccer tournaments, lacrosse tournaments. They're not wearing masks. And we all know about South Dakota that they're not enforcing mask wearing. So your kids are going to get COVID. Here in New York City, COVID has been so well controlled in children, and children are not getting sick because they're wearing masks, that many of our pediatric departments have actually closed their inpatient departments, and we are using them as COVID beds for adults because we don't even see that pediatric patient volume here in New York City. There's so few sick kids that we can contain them in 1 or 2 hospitals rather than 20 or 30 like we normally do.
Yeah, I mean, when you think the number that we mentioned at the top of this segment, Doctor, the number of Americans who have died have now surpassed the number of combat deaths in World War II. It's astounding. I still remember when we talked about the number of Americans dying and that it surpassed the number of dead in Vietnam. And now we're talking about World War II. So let's focus on these vaccines. They're starting trials with teenagers. Pfizer and Moderna started looking for participants at the end of last year, as you know, and expect to have some data by the summer. What are the advantages to getting younger populations vaccinated? We know that older folks right now and frontline workers are getting those vaccines, but what about the younger folks?
Well, we want the younger folks vaccinated because what we have been seeing is that even though the children aren't getting sick, they can spread it. They could be asymptomatic. So it is, in all of our best interest to get everyone vaccinated. So we can't start with the youngest. We usually work our way down. So first we're doing teenagers. But I have to tell you that the trials are so limited that I tried to enroll my 2 teenagers this week again. And the closest sites for my teens are Texas or Idaho. So they're not available in like the big cities like Chicago right now, or New York City or Boston, because I would drive or fly if it was close and reasonable. But the studies are limited. They need to broaden them. They need to enroll more kids. I read that one study is only going to have 120 children. Those aren't valid. They need much bigger studies to enroll more teens, and they need to make them more widespread across the country. But we definitely need them. I'm dying for my kids to get vaccinated.
Oh, that's good to know. Well, I mean, it's good to hear. I think a lot of people would love to hear that a pediatrician who has children feels comfortable with her own children being vaccinated. That goes a long way. I wanted to talk to you about another study, though, a CDC study. It found that hospitals across the country saw an increase in the number of mental health emergency visits from children between April and October compared to the same time in 2019. That study said, of course, one of the factors was that kids just aren't getting the services that they would otherwise be able to have in school. So I want to talk to you about, hearing those numbers. Does that surprise you? How has this shift impacted families? If you don't have a kid who has been receiving these sort of services, you may not realize how crucial going into school every single day and having someone who has kept track of your mental health evolution since maybe you were in kindergarten, having someone know you that well, the difference that it can make, and having that cut off can be tremendously detrimental.
So you have to remember that for many insurance plans, mental health is not covered, especially for children. So the majority of children rely on school counselors, guidance counselors. And then what happened with COVID is you don't have that anymore. And if you do, maybe it's once a month on Zoom. And how many kids can get therapy on Zoom when they're like 7 or 9? It's very difficult. It's very difficult for an adult to do that. So the resources are so limited, and these kids are just, they're really just slowly sliding down into their depression, loneliness, having negative thoughts. They're spending like 4 to 8 hours a day on the internet, often seeing these false images on TikTok and other social media sites where it makes like everybody's life looks better than yours while you're sitting home alone, online, lonely, without friends. We actually had a New York Pediatrics Society meeting about this huge crisis that all these kids are ending up in the ER and we don't have the resources for them. And most mental health work is still only being done virtual, not in person. So it's really impossible to get these kids resources for help. They need to be back in school.
Doctor, President Trump announced that he's lifting COVID-19 travel restrictions that he'd placed on foreign nationals coming from parts of Europe and Brazil. That should take place January 26th after the Biden administration takes office. But the president-elect's press secretary said last night that they won't lift the restrictions. Given the virus variants spreading in some of those countries, is it safer from a medical standpoint to keep the amount of people coming in down? Or, to me, it feels like, well, the virus is already here. We've already started to see these variants popping up in California and some other places. Do these travel bans really work at this point, at this late game in the pandemic?
I actually think they do. And I think that because we had the first travel ban on China, we kind of limited it. And I feel like now with the UK strain, when we could have limited it, we didn't. I think until we have this under control, 400,000 deaths is not a joke. And I don't think it's about politics. I think it's about medicine. I think it's about science. And I think we have to get this under control. And you have to remember, we're in New York City. These are where people are landing. People really aren't flying from Brazil to Minnesota. They're landing in Miami. They're landing in LA, where there's huge outbreaks already. So I think we need to get this under control. And I hope President-elect Biden will, enforce mask wearing like we talked and have different science advisors. And then once we get this pandemic under control, we get more people vaccinated, we can lift the travel bans or, make certain levels of people who can travel if they've tested negative. I'm not a huge fan of the 3-day before I travel negative because I've had patients that have been negative on day 3, but on day 1 they're positive. So if you're not quarantined from that day of your test, you're still getting exposed to coronavirus, and you could bring it to another country or another city.
Yeah, I have a friend who tested negative on a Wednesday and then on Friday tested positive. So it absolutely does happen. The good news is, of course, President-elect Biden has promised to enforce mask wearing on federal locations and on interstate travel. So that will be one thing to the point that you were making, Dr. Hes. Always great to have you. Thank you very much.
Thank you.